topic of my presentation is need for cultural diversity in the nursing profession. The learning objectives are that after reviewing this presentation, the learner will be able to identify the relationship between changing demographics and cultural diversity in the nursing, verbalize how cultural diversity relates to nursing practice, and identify the importance of cultural diversity in the nursing profession. Before I get to the topic, I would like you to close your eyes for a second and imagine a situation when you're on vacation somewhere in Europe, visiting your friend and having a great time. Suddenly you get sick and you end up in the hospital. You're lying in bed, you had some tests done and the nurse comes and says: Dzień dobry, wyniki pańskich testów wróciły i będzie pan miał operację wkrótce. And she leaves the room. Now imagine, how does it feel to be in different country within different culture? Did you understand anything what the nurse says? How do you feel? Are you scared? Do you know what is happening? I let you to think about this to better understand the need for cultural diversity in the nursing profession while I will continue my presentation. The United States is the country of many different cultures due to increased immigration. Just in the past decade, the immigration rate changed from 150 million immigrants in 2000 to 214 million in 2010. The ethnic and racial minority group accounts for 37% of our population, which is 1/3. And then there is a projection that by 2043, the minority will become the majority. With expanding immigration, increasing globalization, and minority population growth, there is a need to enrich the diversity within the nursing profession to better meet the needs of our changing society. But that can be difficult because only 90% of the RNs have minority background. And let's talk right now about the importance of cultural diversity in the nursing practice. How does cultural diversity relate to nursing practice? With our population being so diverse, we right now need a new care model, which requires us right now to use some diverse thinking, diverse planning, and diverse implementation as well. Also, we have to remember that lack of cultural diversity compromises patient-nurse relationship, affects patient health beliefs, practices, and behaviors. And also, we have to remember about elements of the quality care, which are language and nonverbal communication, respect and awareness of cultural traditions and beliefs, and interpersonal and institutional stereotyping and prejudice. Why is this important to nursing practice? Because it's cost-effective care. We don't have to use the interpreter services. We are saving money. We are able to provide quality care because we avoid some misunderstanding or misinterpretation, and it improves patient satisfaction and health outcomes. Why is this important to me? I am an immigrant, and I strongly believe that culturally diverse workforce is more likely to improve healthcare in this country. And in conclusion, I just want to use the Joint Commission report statement that one size does not fit all, meeting the healthcare of diverse population. What it's basically saying is that we need the cultural diversity within the nurses to provide the right care. Using the same language and understand the same symbolic meanings are helpful when promoting health. Also, nurses with cultural competencies are active to defend, uphold, and improve care to clients of diverse cultures. And my discussion questions for my group are: can nurses from one culture give culturally competent care to patients from other culture? What factors may contribute to low number of minority nurses? Should nursing schools recruit more minority students? Why or why not? This is my references. I hope you enjoy my presentation. Thank you.